Daily we use the word pressure for many reasons. A person may say that I am being pressurized by my superiors, and if I ask the superior why you pressurize him, he will say, unless I give pressure, he may not work. So work and pressure has got a lot of relationship. And the purpose of pressure is to make a move, to move certain things. Even if you want to push something, you give pressure and push. Then only the object moves. The same thing in our body. Blood pressure. The blood has to move. Every organ should receive blood. And the blood is transported by the blood vessels. And blood is pumped into these blood vessels by the heart. So the heart generates a pressure and pushes the blood inside the blood vessel, and you measure how much pressure the blood exerts on the walls of the blood vessels, and you call it blood pressure. But before that, I said about blood vessels. If you take all the blood vessels and line up, do you know the length of these blood vessels? You may not believe, but it is about 95,000 kilometers, and you have only 5 liters of blood. The heart pumps 70 ml of blood for every beat, every contraction. In that case, in 1 minute, the heart pumps the whole blood, that is 5 liters of blood, recycles the same 5 liter of blood throughout our lifetime. If you calculate how much of blood is pumped by the heart, every day 7,500 liters of blood is being recycled, but we have only 5 liters of blood. Then how many times the heart would recycle? Around 1,440 times the blood is being recycled by the heart. Now, all these are based on one factor, that is your blood pressure. Unless a particular blood pressure is maintained, task may not be possible. Our purpose of this video is, what is blood pressure? What actually the blood pressure does to our body? Why the blood pressure should be maintained in an optimum level? It shouldn't go up, it shouldn't go down. Why? Well, imagine a house. You have a ground floor and you have the first floor and a second floor. The motor pump is in the first floor. So to pump water to the first floor is very easy because it is in the same level. For the ground floor, because due to the gravity, the motor need not develop pressure to pump water to the ground floor. But the motor should have a specific power, and you call it as the horsepower, HP. There it is HP, in our body it is BP. The same thing happens in our body. The motor pump is your heart. The heart pumps blood to every organ, and it is in the chest cavity or thoracic cavity. The ground floor is your foot, the second floor is your brain, and the first floor is your thoracic cavity. So the heart can easily pump blood to the neighboring organs like lungs because they are in the same floor, like that. The blood from the heart can easily go to the foot by gravity. The pressure is not a matter here. But to pump blood to your brain, which is against gravity, like the second floor, you have to have a specific pressure. Then only the brain will receive blood supply. So imagine this situation. That is why it is called a vital sign. And it is not a constant number. Variations will be there. Normal variations. A very good example is exercise. When you walk, when you run, when you climb, every organ needs more blood. When they need more blood, the heart has to pump more blood. To pump more blood, it has to develop more pressure. So during exercise and emotional disturbances, anxiety, you need more blood to all the organs. So definitely, to pump blood to all these organs, the pressure should be high. It's a normal response. Either the heart rate increases or the quantity of blood which is pumped by the heart increases. both will increase your pressure, the heart rate as well as the volume of blood which is ejected per beat. You call it stroke volume. The volume of blood which is coming out. Every contraction, you call it stroke volume. So heart rate into stroke volume, that is the output by the heart. You call it cardiac output, COP. So I said the heart is in the chest cavity. There is a blood vessel which comes out directly from the heart. You call it aorta. The diameter will be more, around 3 to 4 centimeter the diameter. But if you come to the foot level, the final branch, you call it capillary. It is a very, very, very thin. That means these blood vessels are a distance from the heart, and these blood vessels are very thin. Now, to reach that tip of your finger or toe, the heart has to maintain a particular pressure so that the toe tip also gets blood supply. So this much of importance is there for the pressure. Based on that pressure only, all these organs, including your tip of your finger, will get blood supply. To send blood, to pump blood to the lungs, you need less pressure. To pump blood to the brain, you need more pressure because against gravity. So with all this balance only, a pressure is maintained in our body. So the body will try to correct the imbalance. When the pressure is low, the body will do some compensatory mechanism, either increase the stroke volume or the heart rate, like that, to maintain the internal environment. The next point about blood pressure is the blood is coming out. That blood exerts a pressure on the wall, and you call it blood pressure. So the blood pressure is related to the quantity of blood which is coming out. When the blood quantity is more, definitely the BP will be high. This is one factor. And the blood quantity depends upon how many times the heart beats, that is heart rate, and how much of blood is pumped out, that is stroke volume. So based on this, the quantity of blood will be more, definitely the blood pressure will be more. The next thing is, when the blood comes out, it enters the blood vessel. If the blood vessel's elasticity is poor, then the heart has to increase pressure to pump blood into this rigid blood vessel. So that depends upon the diameter of the blood vessel and the elasticity of the blood vessels. If the elasticity is less, if the diameter is less, then the pressure, you need more pressure to pump blood into this blood vessels. So this blood vessels resist the blood flow. So this resistance will be there till the tip of the fingers and toes. Because they are away from the heart, they are called peripheral blood vessels. And this resistance, you call it peripheral resistance. When the heart ejects blood into the blood vessel, at that time, because of the quantity of the blood, the pressure is more. That is, you call it as systolic blood pressure. That is around 120 millimeter of mercury. The blood comes out of the heart. Now, the heart has to relax to receive blood. The blood which is flowing out will try to recede back. If the opening is not closed, the blood will again go into the heart. There is a valve which prevents this receding. So when the heart is relaxing, the blood vessel, they do not collapse, but they maintain that shape, that diameter. And if you now press this blood vessel, you will feel a pressure inside. That particular pressure prevents the collapse of the blood vessel. You call it diastolic blood pressure. That is what we say, the pressure when the heart is relaxing. That is around 80 millimeters. So the purpose is, during contraction of the heart, as well as during relaxation of the heart, all the organs should receive their blood supply. And that is why when the heart contracts, the blood comes out, the pressure will be more, 120 millimeter of mercury. When the heart relaxes to receive blood, and when the valves are closed to prevent the backflow of the blood in the blood vessel, and the blood vessel maintains its tone, and that pressure will be less because now the heart is not pumping blood into this blood vessel, and that pressure is 80 millimeter of mercury. You call it diastole. Diastole means relaxation. So to supply all the organs at all levels, the blood pressure should be maintained the optimum level. For example, if the blood pressure is very low, the foot may get blood supply, the lung may get blood supply, but the brain may not get blood supply. The brain is very sensitive to oxygen. So the brain goes in a state of hypoxia, and you will feel giddiness, vomiting sensation, etc. Sometimes it happens to people who are standing for a long time, without any movement, standing in the same place for 8 hours. All the blood may pool in the leg. So the quantity of blood which is coming to the heart may be less. So I said the quantity of blood is one of the very important factors which will decide the blood pressure. Now the quantity of blood which is coming back to the heart is less. So BP will be less. The brain may not get enough blood supply. You will feel giddy and you may fall down. You call it fainting. All this because of a low pressure due to the position, standing posture. You call it postural hypotension. Hypo means less, postural means due to the posture, standing posture. Tension means the pressure inside the blood cell. So I said optimal blood pressure. For some people, their blood pressure may be low continuously. It's not sudden drop of blood pressure, but their blood pressure may be around 90 millimeter of mercury by 60 millimeter of mercury. It's a range, I said. 120 means 90 to 120, 80 means 60 to 80. So some people may have a blood pressure 90 by 60 millimeter of mercury, but their body gets accustomed to that particular pressure, and they may not feel the effects of low pressure. But a person who has got 120 or 130 by 80 or 90, if they go for 90 by 60, they may feel the symptoms of low pressure because relatively for them it is a hypotension or low pressure. For them it's a low pressure. What is blood pressure and what is the purpose of blood pressure? How the heart maintains this and some of the factors which decide the blood pressure. And finally I told it's a vital sign. That is why I said blood pressure is very important for the survival of each cell of our body. But 40% of blood pressure readings, they go wrong. Or I can say 40% of people are misdiagnosed, either no blood pressure or having blood pressure. We will see what are the factors why they get these wrong values in my next video. Thank you.